This is your 1 minute warning, 1 minute. Hi, Josh. How are you? Good.
Good morning, everyone. My name is Nirav Shah, and I am the director of the State of Maine Center for Disease Control and Prevention. I'd like to provide everyone an update on the COVID-19 situation across the state. And we begin today's briefing on a sad note. The Maine CDC is able to confirm 2 additional individuals who have passed away with COVID-19. One was a man in his 70s from Cumberland County, and the other was a female in her 80s, also from Cumberland County. These 2 fatalities mark collectively the 8th and 9th passings of individuals in Maine with COVID-19. Nationwide, there have now been close to 6,100 deaths nationwide associated with COVID-19. So in the same way that we here in Maine are mourning the passing of our community members, families and friends around the country are doing so in countless different ways with their own friends and neighbors. I'd like to turn next to the number of cases overall statewide. There are currently 432 confirmed cases of COVID-19 across the state. That represents an increase of 56 cases since yesterday. 75 individuals have been hospitalized at some point during their illness, and 113 individuals have recovered, an increase of 17 since yesterday. We've also are able to report the first confirmed cases of COVID-19 in 2 new counties in Maine. The first is a single case in Aroostook County, and the other is a single case in Washington County. We're also able to report a case of COVID-19 in a student associated with the Thornton Academy. Overall, there have been over 4,100 consults made of Maine CDC staff since the time we began our activation. And one of our goals right now is to continue our epidemiological analysis to look for additional signs of community transmission. At this time, there have only been 2 counties in Maine where we have confirmed the presence of community transmission, and those remain Cumberland and York counties. We do, however, continue to expect an increase in cases of COVID-19 across the state, both in terms of number as well as in geography. I'd like to turn now to a brief update on our laboratory testing. At present, Maine CDC's laboratory here in Augusta has the capacity to perform approximately 3,500 tests for individuals who may have COVID-19. We are continuing to keep tabs on the supply of the chemicals, the reagents that are used as part of this testing, and we continue to make sure that we can order in advance so that our testing capacity at the state level remains as robust as possible. We are also working with private commercial laboratories as well as hospital-based laboratories in our effort to expand the availability of testing across the state. I'd next like to turn to updates on our distribution of personal protective equipment across the state. Personal protective equipment, or PPE, are life-saving pieces of equipment that are worn by healthcare workers and frontline responders to help keep themselves safe from contracting or transmitting COVID-19. For several weeks now, Maine CDC has been receiving and shipping out supplies of PPE to frontline healthcare workers across the state. As we're talking right now, a team of Maine CDC employees working with our partners at the Department of Transportation is in total delivering over 109,000 pieces of protective equipment to healthcare workers and frontline responders across the state. That's 7 full vans of protective equipment that are being distributed as we speak right now. To break that down, these shipments entail over 8,400 N95 masks, over 40,000 surgical masks, nearly 2,000 disposable protective suits, 33,000 gloves, almost 16,000 face shields, and over 10,000 surgical gowns. Again, those pieces of personal protective equipment are being distributed as we speak right now across the state. I'd also like to provide a brief update on the availability of vital assets across the state. As we've discussed, Maine CDC has been working with hospitals across the state to get a better inventory on some of the life-saving assets that we may need to tap into as the outbreak continues to worsen. As of right now, there are a total of 289 ICU beds across the state, 110 of which are available. There are a total of 324 ventilators, of which 267 are available. There are also just under 200 alternative ventilators across the state. And Maine hospitals report the availability of 127 respiratory therapists, not respiratory technicians. I apologize for getting that term incorrect. Respiratory therapists who are currently active in Maine hospitals across the state. As we've been doing these meetings, there have also been questions that have raised about the impact of some of the physical distancing measures that Governor Mills has put into place. And there are different sources of data that can be used to gauge the impact with those measures. One that I'd like to touch on today are reductions in traffic volume. In the past several weeks, there have been reductions of up to 50% in traffic volume, most notably in Cumberland County. And on top of that, since Tuesday of this week, there has been an even larger increase in the amount of reduction. So to be more clear, there has been an even larger decrease in the traffic reduction that has occurred, on the order of about 17% on top of the roughly 50% that has already happened. And so I commend all people in Maine for doing their part and staying indoors, reducing that congestion that we know can transmit the virus. I'd like to end on a reflection about where things stand right now. I recognize that these are difficult, disorienting, and unsettling times. Today's Friday, but what do days of the week even mean right now, especially if you're struggling? A lot of us don't feel okay with all of this disorientation. And that's okay, because it's okay not to be okay. For many of us, we live in a world where science fiction right now is actually science fact. Speaking for myself, there are times when it seems like we're living in a dream. One of those situations where you wake up in the middle of the night and you're not quite sure whether what happened the day before was real or some figment of your subconscious. It's almost as if we're living in a movie that was written, cast, and directed by our literary friend up in Bangor. But unlike a dream, where your subconscious is in control, or a work of fiction, where the author is in control, we are in a situation where we are in control, even though it may not feel that way. We are the ones who are writing the script right now. We are the ones who can control the arc of the story by doing particular things, like physically distancing ourselves, like washing our hands, like covering our coughs, and making sure we all stay healthy. We, all of us in Maine, get to write the next chapter, and we get to write the ending ourselves. So I recognize that these are difficult times, but there are steps that we can all take to take control of the situation. So with that, I'd like to turn to some questions. And again, we're doing all questions with our colleagues from the media by phone. And so I'd like to start with Ashley Blackford up in Aroostook County.
Thank you, Dr. Shaw. Now, Holton Regional Hospital made the announcement on its pandemic hotline that there was a confirmed case in the Holton region. Is that common practice, or is that going to become common practice for individual hospitals to announce via their hotline that there is a confirmed case in a specific region, or is that something a press release will come out for, or should we wait for the CDC to confirm?
So Ashley's question is around reporting of cases, particularly at the hospital level. We at Maine CDC don't have any clear parameters that we provide hospitals as to when or how they should communicate cases with the public. My own view is that we're in a situation where the more information that's coming out, the better it is. But in terms of the official case counts, we at Maine CDC are logging those. Hospitals may also do so and may wish to inform the public as well, and we welcome all of their voices at the table. We've got a lot of folks who are on the line, and so I apologize if my responses are a bit quicker than normal, but I do want to make sure I get to everybody at least once. So next, I'd like to turn to Amy Brown from WERU.
Thank you, Dr. Shah. President Trump is supposed to be coming out with new recommendations about masks, and I'm wondering if you have any thoughts about whether or not people can make more effective masks. Obviously, they're not going to be N95 grade, but should people be wearing them? Do they increase touching your face, as some have warned, and are they giving a false sense of security if they wear them, or do they offer some protection? And if so, what are your recommendations for making them so that they are as effective as possible?
Thanks for your question. Amy's question is about the utility of cloth masks and the potential that they might, the potential for more federal guidance around the use of cloth masks. Amy, as you note, the federal government has not yet made any official recommendations, and so I would reserve comment on those until they come out. But what I can say about cloth masks, two things that I think about when it comes to making and wearing cloth masks. The first is that we must make sure that any type of cloth mask is in addition to, not in place of, the existing physical distancing recommendations, requirements that Governor Mills has put into place. A cloth mask does not relieve anyone of the obligation of maintaining distance from others, avoiding crowds, so on and so forth. And I'd hate for masking to give people that false sense of security. The second question that's out there with masks is wearing a mask may provide some physical barrier, but unless you're really used to wearing a mask for long periods of time, as a healthcare worker or a surgeon, for a lot of folks, putting something on your face actually might lead to people touching their face more, which is, of course, one of the things that we ask people to minimize. So as with a lot of these recommendations, we have to weigh all of it at once and come up with the best thing for all people. Right now, no formal recommendation has been made. If and when it does, I'm happy to discuss it more. I'd like to turn next to Megan from WMTW.
Thank you, Dr. Shaw. My question is about the distribution of PPE. I know that you had talked previously about how some of the distributions were given to the most in need, for lack of a better word, the communities that were underserved, if you will. Is that the same philosophy this time, or who are these shipments going to?
Good. So Megan's question is with respect to the PPE distributions that are going out today and who they are going to in particular. And so, Megan, I'll start by noting that the initial shipments of PPE that were made by Maine CDC were designed to equip the least equipped. Where we are now is that we now want to focus on where we think there will be high patient volumes, high numbers of vulnerable individuals, as well as protection of healthcare workers. And so overall, the shipments that are going out today are in general going to EMS providers, funeral homes, law enforcement settings, and then the predominance of them are going to hospitals and congregate living settings. We've got some additional numbers on the specifics, but what we're trying to do now is, having focused on the least equipped, now we want to focus on where the most vulnerable patients are and where the most vulnerable patients might be, namely hospitals and congregate living settings, places like long-term care facilities, et cetera. We've got additional numbers on those, but that is our approach right now. I'd like to turn next to Rachel Ohm from the Portland Press Herald.
Yeah, Shaw?
Yep, go ahead, Rachel.
Okay. Yeah, my question is about the modeling. I know you talked yesterday about different scenarios that are being looked at, and I was wondering if you can give us specific numbers in terms of the number of cases Maine could see, or when the curve will flatten, or even the number of deaths that are likely under some of those different scenarios, even if it's just a range of numbers. And if you can't give us those, why not?
Sure. So Rachel's question is about modeling and how we approach modeling. The purpose of looking at models around infectious diseases is not so much to try to come up or speculate about what might happen, but it's to try to help us determine whether the resource projections that we are looking at are aligning with the requests that we're making. So again, the purpose of the modeling is not so much to try to guess what might happen, but try to see whether our projections, our requests of the federal government are in line with what anything might show. In this situation, with respect to coronavirus, much of the modeling and much of where we go depends on how effective many of these physical distancing measures are. But two of the findings from our modeling that I think are important are, the first is that under some scenarios, the initial number of ventilators that we requested under certain scenarios would not be sufficient. And so it was on that basis that we increased the number of ventilators that we are requesting from the federal government from 300 to 400 to account and prepare for that worst case scenario. The other interesting finding of some of our modeling is that although there are a number of ICU beds across the state, they're scattered. And so one of the questions that we are asking ourselves now in connection with this modeling is whether the better strategy is to have patients go where the ICU beds are, or whether we should have ICU beds more centralized and have more regional approaches. And again, these are insights that the models help us determine based on where we think patients might be, where we think they might be going. I'd like to turn next to Steve Missler at Maine Public. Sorry, Rachel, we got a lot of people and I want to get through everybody at least once. My apologies. I'm going to turn to Steve Missler next.
Thank you, Dr. Shaw. I appreciate it. As you're probably aware, there's been a lot of reporting about states as they try to bolster their stocks of PPE and medical supplies. How they seem to be competing against one another, and I guess my question is has Maine attempted to buy any of this equipment on the open market? And if so, has it been forced to overpay for things like masks, gloves, etc.? I know there's been some reports that some states are paying, 20 cents for gloves when they used to pay for, used to spend a nickel or even 15 times as much for those coveted N95 masks.
Great. So Steve's question is about the availability of PPE on the open market and how states are reacting to that, and then specifically about whether the prices that we've seen have been disparate from what we've seen previously. So Steve, just yesterday, for example, we placed an order with a supply company in Maine with whom the state has done business with for quite some time for 300,000 KN95 masks. And from what I understand, from looking at the pricing and the quotes and the contracts, the price that we have agreed to for delivery of these masks was not out of line with what has been paid previously or what other states have been paying. So I'm not, although I have seen some of the reports of the gouging or the alleged price gouging, we have not experienced it, and certainly we would not entertain that. If we were to be presented with such pricing by a vendor, we would have extreme skepticism in terms of moving forward with any purchase. So all that being said, the availability of PPE on the private market, which we did put in an order yesterday, has been a challenge. Some of that is just the supply constraint itself. Another piece of it, though, is that, as you note, other states are also bidding in for this, but I have not yet seen, at least from any of the vendors that we've been working with, I am not aware of a single vendor coming to us and saying, hey, we'd love to do business with Maine, but another state is overbidding, so we're going to go with them. That hasn't occurred yet. We are on the lookout for it, and certainly our procurement team would not tolerate that one bit. I'd like to turn next to Ethan Andrews from the Free Press.
Good morning, Dr. Shaw. Can you give an update about COVID-19 testing at Department of Corrections facilities? How many have been tested? What results have come back, and what are pending? And also, can you tell me if you've made any recommendations to the Department of Corrections, given the unique environment there and probably the difficulty of social distancing?
Great. So Ethan's question is about what's going on at the Department of Corrections, and I can provide a quick snapshot, Ethan. Overall, of clients at the Department of Corrections, there have been 11 individuals who have been tested. 7 remain pending and 4 have been negative. That is to say, there has been no client at the Department of Corrections who has tested positive for COVID-19. The Department of Corrections also maintains a dashboard on their website replete with COVID-19 information, and they update that dashboard every day around noon. Now, Ethan, to your earlier question about guidance and cooperation with the Department of Corrections, DOC, Commissioner Liberty, Deputy Commissioner Thornell have been some of the very first groups of people that we worked with starting several months ago, over 2 months ago, as we started planning for our COVID-19 response. They have joined every single one of our incident command meetings, every single one of our briefings and meetings to plan for congregate settings, given the unique position that the Department of Corrections is in with the folks that they manage. We have offered them guidance, both guidance coming from the U.S. CDC, as well as specific one-off pieces of consultation when they've had specific questions for us. So we've met with their medical team as well to make sure that their medical team was up to date on the latest policies. So we are really delighted that we've involved them, and they've been wanting to be involved since the very beginning of our work. And it's been a great partnership with the Department of Corrections. I will turn next to Don Kerrigan from News Center.
Yes, good morning, Dr. Shah. A quick clarification and then a question. The clarification is those 300 masks that you've ordered from a private vendor, can they actually get them? And then my question is, we had the largest, I think the largest single day number of case increases so far today. Even seeing that number, do you feel like we are making progress?
Good. So, Don, let me answer your first question about the masks. A clarification on your clarification. We ordered 300,000 masks, 300,000 N95 masks from a supplier. The question you ask is the right one. It's the one that we asked, which is great. We're glad we've made this order, but what are the likelihood that the order will be fulfilled and fulfilled in a manner that is timely enough for us to get these masks to healthcare workers? Still waiting to hear. We understand that there's a projected delivery date of around April 20th, but again, there are international shortages of such masks. And so I will keep everyone posted if we learn that there will be a delay in that delivery, or indeed if the delivery is not possible at all. But we are very much hoping that this supplier will be able to deliver these masks for us. And so, Don, with respect to the increase in cases, as you noted, we've now seen an increase of 56 cases since just yesterday. That's very concerning. It is, however, consistent with the increase that has happened in, say, our neighboring state, where we are at that part of the epidemic curve, that upward sloping curve, where we do anticipate additional cases, sometimes cases of this same nature occurring. The question you raised, Don, is what does this mean for social distancing, and have we made an impact? Well, the data that we've seen suggests that social distancing in and of itself is occurring, and that's a positive sign. But what we don't yet know as a scientific community is to what extent social distancing will impact the shape of that curve today, tomorrow, versus next week or the week after. What I mean by that is that we know that social distancing is the best vaccine we've got. But the question is, how long does it take before we actually start seeing the signs of that immunity start showing up? What we also don't know is what the world would have looked like had we not put into place these social distancing measures. We get into the world of speculation at that point. But what we know from other states that have implemented these measures earlier, from historical experience, is that social distancing, physical distancing really, is the best vaccine that we've got. I'd like to turn next to Paul Dwyer at WABI.
Hey, Dr. Shah, how's it going? As we see this rapid increase in cases, can you talk about how the gumshoe detectives are going to deal with this? And will we still be able to track every single case back 16 days? And then real quick, on Togus reported a death yesterday. Can you confirm that that's one of the two deaths that you're reporting now?
Great. So Paul's question, I'll take them in reverse order. The first is about a report from Togus. Paul, for confidentiality reasons, we're not releasing or confirming any particular location of death. And so I would refer you back to the VA there. But with respect to what our gumshoe epidemiologists are doing, and I'm so glad you used that term, because that's what they are. They're disease detectives. They're private investigators, but they work in public health. What they do is touch base with every single one of these individuals and at a minimum get a sense of where they've been in the past 2 weeks and the folks that they've been in the closest contact with. The next phase of that is to then reach out to all of those contacts to make sure that those close contacts are taking appropriate public health measures to stay inside for 14 days. As the number of cases that we have in Maine continues to grow, the work that our disease detectives have continues to grow as well. One of the things that we've done is add to that force of disease detectives. So, for example, we've tapped into public health nurses to cross-train them on how to ask the questions of individuals who have been confirmed to get these data. We've looked to other epidemiologists across the agency who may be in their day job They are a cardiac disease and obesity and diabetes epidemiologist. But now we're asking them to do a little bit more cross-training to be infectious disease epidemiologists. So as our workload has grown, as the work we need to do to keep Maine people safe has grown, the force of people that we've got doing it has grown as well. I'd like to turn next to Kate Koff at the Ellsworth American.
Thank you so much, Dr. Shaw. So we're all, of course, hoping that the measures that have been put in place will, flatten the curve and keep hospitals from being overwhelmed. But I'm wondering if it comes to a point where providers have to prioritize who gets treatment, like we've seen in Italy and that we're starting to see in New York, do you plan to drop statewide guidelines on that, or would hospitals be on their own to make those determinations?
So Kate's question contemplates a scenario that we hope doesn't happen, which is a scenario under which very difficult decisions have to be made about care. But Kate, as you've heard me mention, hope is not a strategy where we are right now. We have to have a plan in place. And so in the world of public health and emergency management, there are what are called crisis standards of care that provide guidance for physicians on how these very wrenching decisions can be made in a way that still remains equitable, fair, and ethical. Maine has for many years been working on crisis standards of care documents. We are not at the stage at which we have deployed those, but as we think about our planning, as we think about our worrying in advance, that's something that's very much top of mind. Again, we hope that it doesn't get to that, but in this situation, not only must we hope, we also must plan for that scenario as well. I'd like to turn next to Mr. Patrick Whittle from the Associated Press.
Yes, hi. Thank you, Dr. Shaw. I just had to unmute. The deeper we get into this crisis, there are some authorities out there who are concerned that we could be sort of compounding by creating a mental health crisis, and I'm curious if the state is starting to assemble resources or sort of services for state residents who are starting to feel that already, and what role the state can play in hopefully avoiding that.
So Patrick, your question is around the possibility of challenges in mental health as we move further into this crisis. And I agree with you wholeheartedly. We are facing a situation in which physical distancing could turn into actual social isolation if we're not careful. And I've said this before, and I just want to reiterate it. These are difficult times, and it's okay not to be okay. And I ask everybody to get help, to talk to somebody. There are folks who can be there for you, even if they're not with you. Patrick, to your specific question, my colleague, Director Jessica Poward, who oversees the Office of Behavioral Health within the state of Maine, she and her team have been thinking about this really specific question about how do we preserve mental health and behavioral health at a time when physical health is being challenged around us. She and her team have been doing a lot of planning, activity, and preparedness, as well as deploying resources to the most vulnerable folks. I would refer you to have a discussion with her about some of the specifics. But let me just concur in all fronts that we are all of us, deeply concerned about making sure that an infectious disease crisis doesn't lead or generate into a social recession itself. I'd like to turn next to Bill Trotter at the BDN.
Hello, Dr. Shaw. My question is about the N95 masks that have been placed on order, as well as the other equipment that is being distributed around the state. Do you have a projection for how long that equipment might last before it has to be replaced?
Good. So Bill's question is around the projections for how long the availability of PPE that we have. How long might that last? So, Bill, one of the things that we are asking every single healthcare institution to do is to report into us about what their available supplies and stocks of PPE are. That allows us in close to real time to get a sense of what the utilization rate is. If we see that a particular healthcare institution were using high rates of PPN because they had a lot of patients, we don't need to wait until the next shipment to respond to that. The system that we've set up is that there will be rolling or occasional deliveries on an ongoing basis. There will be deliveries that will be made to individuals who have requested PPE. But if a facility is experiencing an outbreak or a stock out of PPE, they do not need to wait until the next scheduled delivery until they get more. And we're able to do that because we are asking healthcare facilities, especially hospitals, to report in their supplies to us. But Bill, your question raises a deeper one, which is overall, with all the supplies of PPE that we have, is it enough? And the answer is that it's hard to tell. Part of it, of course, depends on which of the various scenarios that we might think of as coming true actually materialize. Another piece of it depends on what the supply chain of PPE looks like. There are efforts underway nationally, internationally, and within the state of Maine to increase our own production of PPE. I'm particularly excited about that last one. Commissioner Heather Johnson at DECD has been leading an effort to increase our own state's production of PPE so that we can have a more reliable supply chain of PPE and really try to avoid the scenario that you mentioned, Bill, of being completely stocked out. We're taking these projections as far into the future as we can to try to make sure we have insight into what's going on. We're trying to push out PPE as quickly as we can, and we're trying to increase the overall supply chain as robustly as we can so that we don't result in a scenario where healthcare providers are asked to show up to work without the protections they need. I'd like to turn next to Brad Rogers.
Hi, Dr. Shaw. Speaking of healthcare workers, is the number still 68 healthcare workers who have COVID-19? Is there any more that healthcare workers can do to protect themselves, and can any of this PPE be sterilized and reused?
Okay, so Brad, I want to take your questions in reverse order. Let's start with the questions around reuse and sterilization of PPE. There are guidelines that we have furnished to healthcare providers on overall strategies to optimize the use of PPE, ways that the PPE can be lengthened and still retain its integrity to keep healthcare workers safe. There, just in recent days, have also been FDA approvals of devices that can sterilize PPE. There's one that was just approved about 48 hours ago, made by Battelle Systems. And so we're looking at the utility of acquiring one of those to try to sterilize PPE as well. No decision has been made there. And our team is evaluating, for example, how much PPE can it sterilize? How mobile is the device, et cetera. And then the big question in all of the sterilization questions is, even after something has been sterilized, how many more times can it be used? So as you can see, Brad, there's a lot of questions still remaining. No final decision has been made. Now, with respect to the number of healthcare workers, we are now currently aware of 75 healthcare workers who have been diagnosed and confirmed to have COVID-19. That is largely in line with the increase that we've seen in other states. When we detect that a healthcare worker is a confirmed case of COVID-19, we take special precautions working with their healthcare institution to identify the cases that they've interacted with, the other individual ill patients that they might have exposed, and try to arrange for testing as quickly as possible. I'd like to just close with one note, which was something that Patrick noted as well, which is just a reflection on the times that we are in. These are, by any measure, unsettling, disorienting, and difficult times. But again, unlike being in a novel written by our friend in Bangor, we have the opportunity to control the arc of this narrative. We are the ones that can write the next chapter, and we are the ones that can write the ending. And the surest way that we, all of us in Maine, can do that is by taking steps to keep yourselves and your families safe, by engaging in that social distancing, that physical distancing, but remaining socially connected, by making sure you're abiding by hand washing rules, by avoiding large crowds, by doing all the things that you would otherwise be doing this time of the year to stay healthy. These are difficult times, but we are the ones that can control how this situation unfolds, and we are the ones that can write the ending. So with that, I wish everyone good health, and I'll talk to you next week. Thank you.